right. Welcome back, everybody, to season 2 of Burning the Couch. Whoop, whoop.
I know. I'm so excited that we're finally at season 2.
I know it's been a long year for everybody. We definitely have a lot of updates to share with you all before, we really get into the meat of things, I guess. But first and foremost, for those of you that are not watching this visually and listening to the podcast version, this is a Zoom recording. We have to do it this way. Unfortunately, I contracted COVID. It's been 2 weeks now, but still somewhat playing it safe. Yes, I am vaccinated. So is my husband, and we both still contracted it. Luckily, we were vaccinated, though, because I can't imagine what the symptoms would have been like if we weren't. So, Michaela and I are still meeting virtually just for this episode to give my house time to air out, and I have a giant can of Lysol. It's like spraying the crap out of everything and washing everything in sanitizer.
Yeah. So this isn't ideal, but I know I thought we were past the Zoom portion of our podcast, but it's still going to be a thing every now and then, I guess.
Well,
but I'm glad you guys are okay.
Yeah, we had like 2 days in the books to record in person, and then I texted Michaela, what was it, like 3-4 days before our scheduled date to meet, saying I think I have COVID.
I know. I actually ran out and got because I had seen Pim like earlier that
like
week,
3 days before that day.
Yeah, so I ran out and got a at-home COVID test, and my husband too, and so we luckily didn't get COVID. But we're glad you guys are feeling better and kind of at the tail end of everything. And Justin still can't taste or smell, apparently,
I know,
right?
poor guy. I mean, I didn't lose my sense of taste or smell, but I had all of the other symptoms like shortness of breath. I felt tired just walking my dogs, or walking up and down the stairs was tiring for me. But I'm completely 100% back to normal now. Like, aside from just every now and then I still have like an irritated throat. But I'm not sure if maybe that's allergies, like allergy related. Justin's completely fine now except for smell and taste, which really, really sucks for him. We were just talking about this earlier.
Well, you can actually make food to your spice level preference.
Well,
for a few more weeks.
He still has the effects of it, though. But I was saying this would have been a great time to have my family bring durian over. Because he just can't handle the smell. But, welcome to having a Thai wife. Yeah, so it's been over a year, really, I think, since the release of season 1. And we did some of it over Zoom as specials, to tide us over until we released season 2. But Michaela, how have you been? What was the year like for you with COVID and all of that?
I mean, I still feel like it's this never-ending nightmare.
I know. It's not like it's gone away.
Yeah. As soon as I'm like, okay, it's like kind of over. Life is getting back to normal. We don't have to wear masks, and people are vaccinated, and weddings are happening again. And then here, sure enough, it's like creeping up again. No, but this last year has been life-changing for me. So for those of you who might know, my grandmother and I were extremely close. Like I probably called her at least 3 to 4 times a day. She was like one of my best friends, very close. And she actually passed last October 2020. And not COVID related at all. She had a lot of other health issues, and she, it was her decision. She wanted to stop dialysis, and she wanted to start in-home services and things like that. So I was kind of like her case manager, family liaison, and medical social worker all at once. And that was, it was actually good that I wasn't doing any clinical work at the time, because there's no way I could have done both.
Yeah.
um so yeah, so it was a big loss for our family, big adjustment for our family, a lot of changes. um but we're it's almost been no, almost a year,
Mm-hmm.
like 10
Yeah.
months or something, right?
Yeah.
Something
It's
like that.
almost.
So um yeah, that's one of the biggest saddest things that I've ever gone through. And it is really good, like the timing of everything. I think there was always a part where I felt a little guilty for not doing clinical work or taking a break. And now looking back, I'm like, I was able to spend like a lot of that quarantine time where I wasn't seeing anybody. I got to spend a lot of time with my grandma before she got really sick. And I
Right.
was available to be there to help her with, just doing stuff that needed to be done, coordinating with doctors, all of that kind of stuff. So looking back, I'm like, oh, there's a reason why I needed that break, and I shouldn't have
Mm-hmm.
been doing clinical work at that time anyway. So now moving forward, we're 2021, and I'm about a month out from opening my own private practice as well. So
Ooh.
yeah, similar to Pim, I'll just be doing telehealth to start, and we'll kind of see where it goes from there, and eventually maybe expanding into an office or something part-time. But
So
yeah, it's super exciting.
exciting.
Yeah, and I think we should maybe even do an episode on that, just talking about things about starting private, because I know a lot of people are interested in starting private practice, or that's a lot of times why people get into the field, is they want their own practice.
Yeah, I think that's something that a lot of people reach out to us about too, and not just through the podcast, but from our friends as well and colleagues. I think the big part of it is they don't talk about private practice in school, right? When we went to school to be a therapist, everyone just talks about, well, all of you are going to be working in the county. You're all going to be working in nonprofit. That's just what you're going to do. And they train us. And which, yes, a lot of it is true. Not a lot of people start off private practice straight from grad school, but there should have been a class that covered what goes into building a private practice and the business side of therapy, because luckily, like, I had a business background from like helping my family with their businesses and whatnot. But had I not have that, I would have been completely lost, and I still am learning too. And you
I'm lost
know
without you. I'm lost without you. So I'm glad that I
yeah,
have
and
you.
I'm mainly relying on, like, people who have come before me, who have opened practices, sending them a bunch of questions and phone calls and sitting down with them
Yeah.
for coffee. And if they can't help me, then hiring other professionals that can, working with CPAs to get my stuff straight. So they're definitely, like, I would have benefited from some kind of business class for therapists.
I mean, just basic stuff in general, even like in high school, like
Yeah.
basic taxes and stuff. Like I mean, I know a lot of people you used to do your own taxes and stuff too, but I don't have the patience. I don't want to learn it. I'd rather just pay somebody to do it and know it's right.
Well, when you have your own business, it's
Uh,
harder as well, right? It gets
yeah.
really complicated than just having a W-2.
Yeah. So,
Yeah.
yeah, that'll maybe be in the future. That'll be exciting. I'm super excited to kind of just be able to make my own schedule. That's something that's always been so important to me, is be able to make my own structure. And I think a lot of times in jobs I've had, therapy jobs or not, it's always been this, gosh, I hate having to be told when I have to work. I don't
Yeah.
like that.
Hmm.
I want some sort of say and structure work around my life versus my life
The
around
other way
work.
around. Yeah.
Yeah. So,
Especially in therapy, right? Because everyone wants late evenings, everyone wants weekends. So having to set those boundaries when you're at someone else's practice, or having to set those boundaries in your own practice as well, because clients will ask. So we'll definitely be addressing some of these
yeah.
things. Um, What else are we doing this season? We're going to be definitely working on and talking about imposter syndrome, touching base on that. We all experience it. Michaela and I still do. No matter how many years you practice, you probably still are experiencing it.
And you're probably the only one that thinks you're an imposter.
Yeah. Yeah.
That's the other thing.
We also have being a therapist on social media, what that means. Michaela handles the social media side of things because I just don't have the patience for it or really understand it. I was so proud of myself when I started doing reels and I told Michaela all about it because I just didn't get it. But she handles all the social media side of things, and it's a lot to manage that. Like being a professional on social media, we've all seen the news, right, about like this doctor or this professional posted something and then got like backlash for it, got fired from their jobs for it. It applies to our field just as much. And then we have a lot of really cool, fun, just a variety of specialty topics. So, things we're going to address in terms of types of therapy or different populations. We're going to have some guest speakers as well. So, very, very exciting season.
Yeah. And, originally we were planning on having this season be January 2021 is originally what we were
Yeah.
planning on doing. But there were so many things with,
Life
Kim's husband was
happened.
on deployment. My grandmother just passed away. Like COVID's still a thing and nobody can go anywhere. And it was just a really dark time in general, I think, for a lot of people. And we were just like, no. I don't even think we talked about it. I think we just were like, there was just this mutual understanding, like, we're clearly not filming right now. We need to take a break.
That's right. I don't think you and I ever went like, hey, so we're not recording the podcast right now, are we? We kind of we just didn't do it.
Yeah, it was just
because we just
mutual.
couldn't.
Yeah. And that's one thing about us is we're so close and we know each other so well at this point. It's like, it didn't even need to be said. We were just like, it's not the time. It's not the time for either of us to be worrying about this. So
it was so much. Yeah, I know. My husband being on deployment was a lot harder than I thought it would be. We've done 2-3 months kind of thing, but this was like an 8-month thing, in the middle of pandemic, limited communication because he barely had any stops, and if he did, he still stayed on the ship. It was just awful, 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 on both ends. And having to juggle working, not seeing my friends, not seeing my family, being completely alone, no husband to talk to. That did a number of work on my mental health for sure.
Yeah. Yeah. It was a very dark time, and I'm glad that, he's back, he's safe, you're, doing well. Besides the COVID thing, you guys are okay. But you guys have some like exciting news. You have a new addition to your
Oh my God. The way you said it makes it sound like I had a baby.
Well, you kind of did. In my book, it still counts.
That's true. She is a baby. We have a new puppy. That's the new addition that Michaela's talking about. No, I'm not pregnant. No, I do not have a human baby. So it's funny because we have a 5-year-old dog as well. And I forget to mention that they're puppies, like they're dogs, because I just assume that people know that I'm a dog person and I have dogs. And so I took my new puppy to training, and I was like, yeah, she plays really well with our 5-year-old. They get along. And then the trainer was like, I just want to clarify, is it a 5-year-old human or a 5-year-old dog? And I was like, you're right. I should have mentioned that it's a 5-year-old dog.
Yeah.
Not 5-year-old son. But she's 4 months. She's an Australian Labradoodle. It's actually different from a regular Labradoodle. They have some other what's the right word? I guess some other breeds down way down the line. And they were originally bred in Australia. It has nothing to do with Australian shepherds. People think it's
Oh,
Australian
that's
shepherd,
what I
Labrador
thought.
poodle. Exactly. It was just the guy who created it, created this breed, was from Australia or in Australia. So um, just way down the line, she had other breeds in her. Anyway, she's an Australian Labradoodle. She's super adorable. She's going through this toddler phase right now, though. So she's like regressing here and there, being really like grouchy. My husband calls her a demon baby. I don't see it because I love her.
She
But
can
she's
do no wrong.
teething. She can do no
Yeah.
wrong. Well, she's teething. That's why. So she's just, grouchy.
Yeah. And you're actually putting her through the process to become a therapy dog, correct?
Yes. So she's only 4 months, and this is proud mom me talking right now. But her trainer is super proud of her because if you look at the list of things she needs to do to pass her test, she's got like 80% of it down. She's very, very good. She can be a total maniac at home, but there's something about her breed that, like, when we take her to the training place, she is super ready to work. She sits, she lays down, and she looks at me like, tell me what to do. So for anyone who don't know, Australian Labradoodles are bred to be service dogs and guide dogs. So I actually got her from a reputable and certified breeding program that breeds for like service animal centers and stuff. So I'm working very hard to incorporate animal assisted therapy into my practice. It's kind of my next step. Um, and it's fun for me. Like, yes, all of my colleagues are doing EMDR and all this really cool stuff, but like, I love dogs and I wanted to do something that feels natural for me, that's fun to do because I love training her and I love like playing with her. I feel really proud when she accomplishes a certain task that she's been trying to work on. So it's been like a fun process and fun thing to do, despite it being also like a professional career oriented thing.
Yeah. And that's really exciting. We'll definitely need to have you update us on the process and what that looks like, because
Yeah.
I'm sure there's other people that are interested in, or have thought about like, oh, I want to bring, therapy dogs into my practice or incorporate it somehow. And just for those of you who aren't familiar, this is not like an ESA, an emotional support animal. This is actually training the dog to work. So yeah, no, I'm excited. So, and she's adorable. She's already huge.
I know she's growing so fast. She's already outgrown her 5-year-old brother. Actually, Michaela, you haven't seen her in a long time. She's pretty much bigger than Obi now. I know, which is insane because it's this giant, like 30-pound puppy. Because she acts like a puppy. She's still not
Oh
coordinated and
yeah.
falls on her face, but she's big.
Yeah, big and clumsy, giant fuzzy paws. Oh, I love it. I
Yeah.
love it. So that's super exciting. Um, yeah, a lot
Yeah.
of new updates.
So this was kind of more like an welcome back update kind of episode just to warm everybody up. Hearing our voices again, I guess, and getting used to us. We're going to have such a fun season coming up. So, so excited to bring you guys along.
Yeah, and we actually have, people have reached out to us asking for us to cover certain topics and things like that. So we're going to try to incorporate stuff, your feedback into, future episodes and talk about what you guys want to hear.
Yeah. All right. I think we're good.
All right. Well, we'll see you at the next episode.
All
Thanks for
right.
joining. Don't forget to follow us on Instagram at Burning the Couch. And then you can also email us as well if you have any questions about like collaborating or if you want to be a guest. That would be the place to do it. It's on our website. There's an inquiry form now that you can fill out.
I know that's totally new because we've been getting a lot of people asking, and we're like, we should have a formal way of doing this. Thank you for closing. I completely forgot. See how long it's been since we've had a recording that I'm like, I think we're supposed to do something at the end. Oh, right. Yeah. Go follow us and like us. Do that.
Subscribe to our shit.
Subscribe.
All right. Well, thanks everybody. We'll see you next time.